Thank you. I know that Commissioner Traylor, we spoke yesterday about it, but I know that without those, on page 7, your total Medicaid spending from 2011 to 2015, currently we would be spending $29 billion. That number includes, just to reiterate, that number includes the waivers and DSRIP and all those supplemental, or is that separate and apart from any other revenues we would get?
The $29 billion that you see in 2015, that is total Medicaid spend.
Right.
And then the line below that, supplemental payments to hospitals, that $9 billion. When you add those together, it's 38. You get to the $38 billion.
38. Mm-hmm. So what would happen if we didn't have those supplemental? Those aren't automatic, right? I mean, we have to go through a process to get those.
Yes,
right?
we do. I think the supplemental payments, I think if you look at the state Medicaid program, Texas has been unique in many ways. We have access for our Medicaid patients through private hospitals that a lot of states don't do. And those supplemental payments, and you can talk about our Medicaid payment rates, and we frequently do, but those supplemental payments have provided access for our clients across the state, our Medicaid recipients, to have access to private hospitals and the networks that go along with them, that without those supplemental payments they unlikely would have. They would have some access. I don't want to say they would have none, but they would unlikely to have the kind of access that they are able to enjoy right now. And I think our networks would certainly be challenged without those supplemental payments.
Would you say that some hospitals would close without those payments?
I haven't done an analysis on which hospitals may or may not close. I would say that.
Let me rephrase that. Do you think that access would be limited without those payments?
I want to be really careful how I say this, but I think it would be challenged certainly more than it is now. One of the things to remember is that we have 4 million people in the Medicaid program right now, and another 500,000 in CHIP. The likelihood of that growing over time, just with the Texas population, is pretty high. And so one of the things you'll see throughout the presentation when we talk about working with providers is to ensuring that we have adequate networks to serve individuals that touch our system. And so I think those supplemental payments have played a significant part in ensuring access, not just to those inpatient hospital services, but to outpatient and clinics and other things that are in the healthcare continuum that our hospitals have been able to provide.
So those supplemental payments include the 1115 waiver?
They do.
And do we have I know that it's a topic of discussion. It's been a topic of discussion from last committee hearings, Chairman, and thank you, Chairman Otto, for talking about it towards the end of session, but where are we on that 1115 waiver process?
Again, I need to choose my words carefully on that because I am in discussions with CMS, but I am much more optimistic about having a reasonable short-term extension to the waiver than I am about the Rangers making the World Series this year, for sure. Yeah.
No, they might make it.
Yeah, they sure.
But you got the Astros in front of you.
The Astros are looking strong too. But I would say that I have a high degree of optimism that we'll be able to achieve something with our federal partners in time, where our hospitals across the state will be able to plan for the upcoming year. I don't, to be honest with you, I don't believe that. That a 5-year extension, as we requested back in the fall, is something that's in the cards. But I think a short-term extension that allows the state to look at other options is something that I am extraordinarily hopeful about, and I will trust but verify when we get papers to sign and that, then I will breathe the sigh of relief back then. But we are fully cognizant of, as are our federal partners, of the importance of extending to our safety net system, as well as those district projects which have been able to provide substantial mental health benefits across the state, as well as access and system reform. I'm extremely optimistic that we'll be able to have something that allows us to plan over the next 18 months to 2 years in a way that we can make strong decisions and put you in a position next session where you'll have a number of decisions that you'll be able to make with regards to the Medicaid program.
Thank you, Commissioner.
Thanks, Commissioner.
Bet.